All right. Well, good afternoon. Thank you everyone for joining us. Today we're going to talk about hearing conservation and how you can protect your hearing. My name is Stephanie Ramirez. I am a speech language pathologist here at North Kansas City Hospital. I primarily work in outpatient, but I also do help with acute care, and I have helped on the acute rehab unit as well. To those who tried to tune in earlier with our technical difficulties, I apologize again, but thank you guys for tuning in, and I hope that you find this information very valuable to you. So my plan for today is to talk to you about noise-induced hearing loss. We're going to talk about dangerous and safe noise levels, and then how noise can affect your hearing and your health. And then finally, how we can take steps to protect our hearing. So first and foremost, what is noise-induced hearing loss? So that happens when you listen to loud sounds over a long period of time. So anything, we measure sound in decibels, and anything over 70 decibels can be detrimental to your health and your hearing over a long period of time. So there are some examples there, and I'll give you some more, but typically the recommendation is for 80 decibels or less, 40 hours a week. For children, that is 75 decibels. So their hearing is a little more sensitive. So when we're thinking about those loud sounds that would be unsafe, what are we talking about? So very loud things that are going to be dangerous to your hearing are things like motorcycles, lawnmowers, things that are typically more than 85 decibels. We like to be cautious of. Things that are extremely loud are things like rock concerts and chainsaws, leaf blowers, snow blowers, tractors, things like that. Things that are not safe for any period of time, they would be a painful noise. Things that are over 140 decibels are things like jackhammers, jet planes, sirens, fireworks, and firearms. So those would not be safe for any period of time. On the other hand, things that are safe are things like conversations, vacuum cleaners, alarm clocks, dishwashers, dryers, and obviously anything that you would consider quiet, rainfall, a library, things like that. Anything that's going to be 70, 80 decibels or less. So if you're out and about and you notice that things seem pretty loud, how can you tell? We're not going around with a sound level meter. So some signs that the noise is too loud during the activity, you notice that you're needing to raise your voice to be heard. And you can't understand someone who's 3 feet away from you. If it's too loud to hear them, then it's too loud for your ears. You might also notice after the activity that speech or sounds around you sound muffled or dull. You might have pain or ringing in your ears that can last for a few minutes or a few days. So to understand how sound can damage our hearing, I think it's important to know how normal hearing works. So this is just a pretty basic diagram here. So noise enters your outer ear there and vibrates your eardrum. The eardrum then vibrates those tiny bones in your middle ear. There are 3 of them, and the last of them move fluid in your inner ear, which bends hair cells in your cochlea. And those hair cells change the vibrations from the sound into electrical signals, which are then sent to your brain. So it goes all the way from outside of your ear into those tiny little hairs in your cochlea, and then it goes up into your brain. So it's important to remember that those hair cells in your cochlea, only healthy hair cells can send electrical signals. So if those hair cells are damaged because maybe that sound wave is too large, so the sound is very, very loud, so it's going to push those hair cells that displacement of the fluid in your inner ear is going to push those hair cells more forcefully, and some of them will be damaged. And so when they're damaged, then that's, over time, that's going to lead to those hair cells dying, and then hearing loss will take place. So there are two different kinds of hearing loss. So what we are talking about here is a sensory neural hearing loss. That is from noise damage, aging. So those hair cells can also be impacted by age, drug side effects, blasts, explosions. On the other end of the spectrum is conductive hearing loss. And those are things that are, kind of foreign bodies. Typically, those are things like fluid, earwax, allergies. And then if you have a little bit of both, you're diagnosed with what they call mixed hearing loss. And those types of things, you might be affected in both ways. So like I was saying, damaged hair cells in your cochlea do not send signals to the brain as well as they should. Unfortunately, the first hair cells that are hurt are usually those that send the high-pitched sounds to the brain. So a lot of my patients who are experiencing hearing loss say that it's harder to hear female voices than male voices. And that's because the female voices are higher pitched. And so those are the sounds that go first. As you can see, 1 in 4 adults have hearing loss due to exposure to too much noise. So this is something that affects a lot of people. Now, if you suspect that you're having some hearing loss, you might be taken to see an audiologist, and that is a hearing specialist. They can do specific hearing tests to see what frequencies you are able to hear, and they come up with what's called an audiogram, which there's an example down there below. So you can see the higher threshold of those decibels, the higher frequencies up at the top, then you're going to need a louder sound to be able to hear those higher decibels, because those higher frequencies rather, because those are a little bit harder to hear. So what are the repercussions of having noise-induced hearing loss or being around loud noises for a long time? Something that I think we all can agree on is that being around loud sounds all the time will definitely make you more tired and probably cranky. But what you might not know is that loud noise can also lead to other health problems. So things like high blood pressure, a faster heart rate, upset stomach, difficulty sleeping. Even pregnant women, if they're around loud sounds, that can lead to problems with how the babies develop before birth. And continuing on, noise can make it harder to pay attention. Noisy classrooms make it harder for children to learn, and it's really hard to understand what others say when it's noisy. So you might be, having difficulty at work because maybe you're not hearing, warning signals or equipment problems. You might get less work done because it's taking more concentration and more energy for you to hear. You might give up trying to talk or listen because it's just too hard. Conversation's too hard. So you can see that noise definitely does more than just cause hearing loss. It can impact your health, your work, your learning, and your social life. So if possible, it's really a good idea to cut down on the noise in your life for all of these reasons. In addition to some of the other conditions that I mentioned, you may also have heard of the term tinnitus or tinnitus. That's the medical term for ringing in your ear. And so that can be in one or both of the ears, and it's not caused by an external sound. Other people can't hear it, but it does affect usually 15 to 20% of people, and it's really common in older adults. So, this can be caused by things like exposure to loud sounds, whiplash, medication. And so, that's something that a lot of people deal with. It's always good to talk to your doctor about it, seek medical care, because if there's something they can do to help, then you absolutely want to take care of that. Sometimes people with tinnitus experience dizziness, hearing loss. If you do feel like you have ringing after a cold that lasts longer than a week, again, you definitely want to get that medical care and see what's going on. Another hot topic with hearing loss lately has been the connection between hearing loss and dementia. In one study that tracked 639 adults for 12 years, they found that mild hearing loss doubled someone's risk for dementia. Moderate hearing loss tripled the risk, and people with severe hearing impairment were 5 times more likely to develop dementia. So why is that? Well, they had a couple of hypotheses after this test. And basically what they came up with is they thought that perhaps because your brain is getting less signal from your ears from those hairs in your cochlea, it's not getting stimulated in the same way. It also has to work harder because you're not processing the sound in the same way. It's not as easy. Your brain ages more rapidly because of that. In addition, people who have hearing loss are oftentimes more socially isolated because it is just such a burden to try to carry on a conversation, and that social isolation can impact your brain. People that have hearing loss, because it helps with balance also, as you walk, your ears pick up those subtle cues that help with balance. You have an increased risk for falls. And then I think just all of this cumulatively can lead to an increased risk for depression in this population. So just to kind of drive that home, hearing loss has long-term effects on your health. It leads to higher healthcare costs, and research shows that people with hearing loss have over 10 years a 47% increased rate of hospitalization. So definitely something that I think we want to take seriously and really be proactive about. So how can we do that? Well, first of all, I think the easiest thing to do is, know how noise impacts you. And you've taken that first step by attending this talk and, avoiding those loud noises whenever possible. If you have to shout to be heard, it's probably too loud, and you should try to get away from the noise or find a way to protect your ears. And so some of the things you can do are wearing ear protection. So earplugs go into your ear. They totally block the ear canal. They come in different shapes and sizes. They can be custom made for you. So those can decrease that noise by about 15 to 30 decibels. Ear muffs fit over your ears, so they have to fit tightly to block the sound from going in, but they can also decrease the noise by 15 to 30 decibels. So you also want to reduce listening to loud sounds for too long. So you're probably going to want to, decrease the volume on some of your personal listening devices, especially the ones that those kiddos are using. You might also look for noise ratings on appliances, power tools, hair dryers, things that you can to buy quieter products, and maybe even when buying toys for children, just choosing things that are a little bit quieter. Movie theaters, health clubs, dance clubs, bars are very noisy. And so you might want to kind of be mindful about where you choose to go, or, maybe even ask that they turn the volume down when you're there. Again, you should use earplugs and earmuffs together if you know you're going to be around the loud noise, especially if you're going to be around it for an extended period of time. If you need to, if an emergency vehicle passes by, you can plug your ears with those fingers as well. But just trying to be proactive with protecting your hearing. Some other really good ideas to kind of get a head start on protecting your hearing are things like getting a hearing test. At your next physical, you can ask for a hearing test as part of your routine checkup. You can ask to have your ears looked at, treating earwax or fluid buildup. Knowing your family history is also really important, because a lot of times the sensitivity of the hair cells and just your response to loud noise can be very genetically tied. Again, medications can cause hearing loss in some cases, or different medications are more linked to hearing loss rather, and those are typically called ototoxic, ototoxic. And, they can range from over-the-counter medications to things like chemotherapy drugs. And a lot of times there's alternative drugs that you can take and avoid those. Just remember, the healthier you are overall, the better you can preserve the hearing you have. So, managing your blood pressure and your cardiac health can help, with those fragile mechanisms inside your ear, stopping smoking and vaping and limiting alcohol. Those can have, toxicities to the ear as well, keeping diabetes under control. A recent study showed that people with diabetes are twice as likely to have hearing loss. So just like with high blood pressure, diabetes can damage the cells in your inner ear. So keeping that blood sugar under control is a great idea. And just in general, eating high foods that are high in vitamins and minerals, B12 is really good for your hearing, potassium, magnesium, and, trying to eat a diet that's really rich in iron. All of those things are great. So if you can take those preventative measures now, it'll set you up for better hearing in the future. Now, what do you do if you already have hearing loss or you're living with someone who has hearing loss? I think there's a few things right off the bat that you can do to help you cope. I think, first of all, it's important to let people know, asking people to face you when they're talking and trying to speak more slowly and clearly, maybe speak louder without shouting at you. You can learn a lot from facial expressions and gestures. So having that visual is helpful. Checking for understanding. If you need to, ask for them to repeat. Finding a quiet environment to talk is really helpful. And of course, be patient, because you might have a little bit more trouble. But again, your doctor might refer you to another professional like an ear, nose, and throat doctor, an otolaryngologist, or an audiologist who can help diagnose and treat your hearing problem more specifically. Nowadays there's so much technology out there, and I don't know if anyone has been following the news, but actually just back on August 16th, the Food and Drug Administration issued a rule creating a category of over-the-counter hearing aids, and that's going to take effect as soon as mid-October. So by mid-October, adults with mild to moderate hearing loss will be able to buy hearing aids without a prescription, and they should cost about $600 to $800 a pair. Traditional hearing aids cost, between $5,000 and $14,000, and of course, their specialty fitted and followed up with the professionals. So this is quite a change from the FDA. It won't target someone's specific hearing loss as far as the over-the-counter hearing aids, which those require evaluation and calibration. I kind of tell my patients, it's like if you go to the doctor and you get eyeglasses, but you don't see the optometrist to get them calibrated to your eyes. That's basically what it's going to be like if you pick hearing aids, but you don't get them calibrated to you. So they might help, just like you can buy readers at the store, reading glasses, but they're not going to be as specific to you as if you were to go and get a prescription pair. So it's just based on the need, but I do think it'll be really nice for people to have that accessibility to hearing aids who might not have had them before. Cochlear implants are available for those with profound hearing loss. Assistive listening devices are things that just amplify the sounds, especially with those places that have a lot of background noise. You can have an AAC device, augmentative alternative communication device, that can be, a picture board, a computer program that can help people with hearing loss express themselves. There are alerting devices that you can connect to doorbells, telephones, or alarms that also emit, blinking lights so that someone with hearing loss knows that something's going on when the sound itself is not going to have any impact on them. So there's a lot of stuff out there. I think it's just finding what is going to work best for you. And so to kind of wrap up, what I wanted to talk about were some of the common complaints that I hear in my office, and just kind of talk about, my response to them. So the first one I hear a lot is, well, my hearing's not that bad. And when I did a quick search, it said that hearing aid users wait on average 10 years before getting help for their hearing loss. But, think about it, that's 10 years of limited communication, isolation, and those health risks that are increased. So I think just the research really points to how important it is to be proactive in addressing your hearing decline. The second one, I'm wearing hearing aids, or wearing hearing aids means I'm old and I'm not ready for that. Well, I think it's normal to feel worried that your hearing loss means you're aging and kind of want to hide that. A lot of people, I've had my family members do the same thing, will just sit silently rather than joining in a conversation because they feel like their hearing will make them seem less competent. But the truth is that connecting with others, staying active, staying social will help your brain stay younger and keep you involved with life. So I think that it really will help keep you young. I don't like the way hearing aids look. So I think that those giant, big whistling earpieces are a thing of the past. Today's hearing aids are a lot smaller, less conspicuous, than they were before. Mike Singletary, Bill Clinton, they wear hearing aids. And I don't think anybody would know if they didn't tell people, because they are very inconspicuous. I heard that hearing aids are difficult to use. And again, just like my analogy with the glasses, I think there is a period where you have to break them in, where you have to kind of adjust your brain and your life to hearing aids. But I think that that's where those audiologists and doctors can really help support you, because they can make sure that the type you've chosen is right for you. And lastly, but not least, hearing aids cost too much. So unfortunately, at this time, health insurers, very few cover the cost of hearing aids. However, what I would say is that the cost of the hearing loss would be much greater, and that the cost that you spend on helping to preserve your hearing would be money well spent. And again, just like I talked about, this new FDA rule is going to make hearing aids hopefully much more accessible for people who are on a fixed income. So to end, I wanted to give you a quote from Helen Keller. Blindness separates us from things, but deafness separates us from people. So just keep that in mind. We want to stay connected, stay social, keep our brains healthy and happy, and the body healthy and happy, and our hearing is a huge part of that. So I have some information here on organizations that deal with hearing loss. So definitely feel free to kind of reach out to them or check out their websites, because I think you'll get a lot of good information. and you can pause the video if you want to take down any of that information. And then finally, I'll give you my information here as well. I'm happy to answer any questions that you have. Like I said, I am a speech language pathologist. I'm not an audiologist, but I do know how important hearing is. And I do work very closely with audiologists in my field. So I think that hopefully if you have any questions, I will at least be able to point you in the right direction. So I appreciate all of you tuning in, and I hope you have a wonderful rest of your day.